My name is Pat Iyer. I'm a legal nurse consultant who has helped attorneys with over 100 emergency department medical or nursing malpractice cases. The emergency department is one of the highest risk areas of the hospital. In this video, I share tips about the liability associated with one of the highest risk processes in the emergency department, having patients wait for treatment. Most legal nurse consultants and attorneys are aware of stories of patients who have been triaged in the emergency department and had a delay in treatment. The patient was triaged, sent to the emergency room waiting room, and waited and waited and waited. And then the patient's condition worsened while waiting. Two questions arise. Was the person appropriately triaged based on the complaints? Was there a delay in treatment given the severity of the symptoms? And second, how long should the patient have had to wait for treatment? Was there a standard for how frequently the patient should have been assessed, or how long the patient should have waited in the waiting room? The number and mix of emergency department staff on duty affect the waiting time. Other factors include the time of day, the number of patients in the treatment area, the condition of the patients in the treatment area, if the department is on divert, the number of patients who are being triaged, the number of patients who are boarding or waiting for a hospital bed, the number of open emergency department beds available for patients to be seen, the location of the emergency department with longer waits in urban areas than in non-urban areas, the volume of annual visits to the emergency department with longer waits associated with busier EDs, handling 50,000 or more visitors per year. The National Center for Health Statistics found that between 2003 to 2009, the mean wait time in emergency departments increased by 25%, up to 58 minutes. In this situation where there are waits, patients' lives can be affected. Tissue can die. For example, a spinal cord injury, a compartment syndrome, myocardial infarction, or hemorrhage can all be affected by how soon treatment is begun. I discuss the liability issues associated with emergency department in my new book, Analyzing Emergency Department Medical Malpractice Cases. I wrote this book to assist legal nurse consultants and attorneys who handle emergency department medical malpractice cases. Get ordering information at the link below.